everyone. Yesterday I made the mistake of speaking to a non-microphone. Today I'm doing better. My name is Paul Freimer. I'm the acting director of the Law and Public Affairs program here at Princeton. Thank you for the spotlight. I'm also a professor here in the Department of Politics. On behalf of the Wilson School, the Law and Public Affairs program, and the Center for the Study of Democratic Politics, it's my pleasure to welcome Cass Sunstein here to Princeton. Professor Sunstein is currently the Robert Walmsley University Professor at Harvard. He is also the founder and director of the program on Behavioral Economics and Public Policy. Just in the last few years, in the first administration, or the first 4 years of the Obama administration, he was the administrator of the White House Office of Information and Regulatory Affairs. Professor Sunstein is one of our nation's leading legal scholars and foremost scholars of both that combines our understanding of law, public policy, economics, and in a sense, common sense. He has written many significant books as well as even more critically important law review articles. Among his many books, Republic.com, The Second Bill of Rights, Nudge, Improving Decisions About Health, Welfare, and Happiness, Why Nudge, and today's talk, which he'll be focusing on, Simpler, the Future of Government. Now, at the completion of his talk, we will take questions. We ask that students here ask the first question, so if you're a student, please come up quickly to the microphone. We have 2 microphones here, and then we also ask members of the community to ask questions as well. Professor Sunstein will be signing books outside, actually next door in the Schultz cafeteria, or I think it probably is a better word than that, Schultz something or other, reception room. But he will be signing books there. So we're going to take the last question at 5:40, and then after that adjourn over there to welcome Professor Sunstein even more directly. But right now, please join me in welcoming Professor Sunstein.
Okay, great. Well, I'm thrilled to be here. Princeton is an astounding place in every way, and it was actually my first choice when I was graduating from high school, and I did get in, but I ended up not going because the squash coach at Harvard recruited me, and the squash coach at Princeton didn't. I was an avid squash player, and that's not a very interesting story, but I'm a great fan of Princeton. So there's a recent novelist who tells a story about a couple of young fish who are swimming in the ocean, and they pass an older fish who looks at them and says, "How's the water?" And they don't say anything, but after the older fish passes, one of the younger fish says to the other, "What's water?" This is really about what's water. So the idea is that there's a social background that private and public institutions create. It's water. Sometimes it's easy to navigate, sometimes not so much. And the question is what can be done to make it a bit better for people. So that is me before I started working in government. A little more like Brad Pitt than now. And this is a scene from the movie Moneyball in which Brad Pitt is playing Billy Beane, the general manager of the Oakland Athletics baseball team, and emphasizing the importance of evidence rather than intuitions. So in the dialogue that portrays in the movie, an old scout, someone who uses intuitions and experience, professional judgment, says about a prospect, "The guy's an athlete, Bill. There's a lot of upside there." Billy says he can't hit. The old scout says he's not that bad a hitter. Paul, the statistics-obsessed assistant to Billy, reads the stats, which show that he's not walking and getting a lot of extra base hits. Billy says, "My only question, if he's that good a hitter, why doesn't he hit better?" The scouts keep saying the guy has a great body, or the guy may be the best body in the draft. And when they do, Billy says, "We're not selling jeans here," and deposits yet another highly touted player loved by the scouts onto his Well, none of you looks under the age of 12, so on his shit list. Okay, I was privileged in the Obama administration to help oversee federal regulations, and the president directed me to pay very careful attention to the human consequences of rules in an economically difficult time. The best way we have of paying attention to the human consequences of rules is to give careful analysis to the costs and benefits of regulations. Under Bush, you can see there were net benefits in the several billions of dollars, somewhere between 3 and 4, maybe a little short of 5 possibly. That's an achievement, even though it's the lowest here, because it's in the black rather than the red. And those billions of dollars actually mean something for human beings. Through 3 fiscal years, the number for the Obama administration is more than 25 times that. And actually through 4, the numbers are now in draft, not through peer review. It's a lot higher than even the $91 billion you're seeing. It's up to $150 billion. We can't quite take that to the bank because peer review and public comment hasn't finished, but it's looking like a form of regulatory Moneyball. What does that mean concretely? Well, it includes billions of dollars in savings for consumers, including people in the room, and I'm hoping this isn't sounding like Obama administration propaganda, because the relevant rules have bipartisan support. They involve, for example, energy efficiency requirements, which are extremely simple, but which mean that consumers spend less for refrigerators and clothes washers and clothes dryers. Most famously, they include billions of dollars in savings from automobile fuel efficiency rules, which are making our fleet much more inexpensive for consumers to operate, saving a lot of money actually in the short term. The benefits of these rules include thousands of lives saved and tens of thousands of illnesses and accidents prevented. And this particular moment is actually quite timely on this because arguably the most beneficial rule in American history in terms of health impacts was just within the last 8 days upheld by a federal court. It involves mercury and associated pollutants. The result of that rule is to prevent thousands of deaths annually. That's thousands of deaths annually, as well as to prevent thousands of heart attacks and tens of thousands of lesser illnesses, especially from people who face asthma. There's just one little rule from the Food and Drug Administration, 2009 I think it is, that's preventing up to 79,000 cases of salmonella illness and protecting against dozens of deaths. There are also, and this is something that doesn't necessarily get the blood racing, but very much has to do with the simplification project and hasn't gotten much attention, which is billions of dollars in economic savings for businesses. So what we've seen in the last years, pretty quietly, has been an effort to eliminate regulatory requirements that don't do much. They're like, they have a good body, the best body in the draft. They sound good. Some interest group might like them. They may poll very well, but they're not doing anything to make people's lives better. And they are imposing hardship on businesses large and small, sometimes patients and nurses and doctors, and they're being eliminated. Okay, here are 3 concepts for you to help organize the talk. One may be familiar. The idea of nudge is to influence people's choices, but let them go their own way if they see fit. So you can think of a GPS as a canonical nudge, and it's really simple, a GPS. It tells you the direction that you should go if you want to get where you want to go, but if you don't like the advice because you know better, or because you want to take the scenic route, or because you have a nostalgia, or because getting lost is kind of fun, you're welcome to try those things. There's a cafeteria in New York Google runs, sometimes called the Nudge Cafeteria, which before it was called that was getting people pretty heavy because there are a lot of chocolate and candy. And what Google did was to nudge people in the direction of healthier choices by redesigning its cafeteria so that the healthy choices were the most visible and first, and the less healthy ones weren't banned or anything. People could get them if they wanted, but they were in the background. So the idea is to preserve freedom of choice fully, but to steer people in directions that they on balance will benefit from and will themselves recognize that. Okay, the second point has to do with architecture. And here the idea is all of our choices have an architecture behind them. If candies are in a green wrapper, people who like health and the environment are more likely to buy them than if they're in a brown wrapper, even if they are pure milk chocolate and have nothing to do with the environment. There's some evidence that if people sign a form first, they're more likely to be honest than if they sign the form last, because signing first primes honesty. It's a really simple initiative. The notion with color and where you sign, how you design a website, what you see first, what you see last, what you see in a big font or a little font, these are all simple interventions that reflect a kind of architecture. And choice architecture really is that water that the little fish don't have a word for, but it's the background that they take for granted. One thing that could, I think, cause a legitimate question and even objection is that those who devise choice architects are kind of worrisome. They have a power over us, even if they preserve our freedom of choice. That's completely true, but notice that's not an objection to choice architecture, because human beings can't live in a system that lacks a choice architecture. That's not possible. Okay, the third idea is that complexity is surprisingly harmful for both private and public sectors, and you can do a lot of good just by moving in the direction of greater simplicity. The non-success that was the early rollout of healthcare.gov has kind of dominated a smaller story, which is actually a success story, where the Obama administration, after I left, released a form for application that was 21 pages for applying for healthcare, and it was widely regarded and rightly regarded as daunting. And the administration listened and came up with something much shorter, just 3 pages. It's simpler. There's all the reason in the world to think that difference between the 3-page and the 21-page form matters greatly to uptake, which is to suggest that the simplification project, which might seem kind of technocratic and self-evident, can have very important human consequences, and I'll give you some details. Okay, what is a nudge? As noted, GPS is. This is an elephant nudging another elephant, as you may have noticed. And that little elephant, I like to think, can, if he or she wants, go right into that bush. Elephants are strong, they can go over bushes, or can turn around, but there's a little nudge there. Okay, this is slightly off color, so forgive me. This is the only scandalous part of the talk. The men here will know. You know what this is, guys? This is a urinal, and the women probably, you know that too? Yes? You've seen that before? No? That's what it looks like. That's a urinal. Amazing that men go to these things? Okay. But that's not just any old urinal. It's a urinal with a picture of a fly on it. And this comes from the airport in the Netherlands. And the idea is if you put a little fly there in the urinal, the problem of spillage, which the Netherlands airport faces, is meaningfully reduced. Indeed, the little fly reduces spillage by 40%. When men see the fly, apparently they can't help but aim at it. The Netherlands has gotten very clever at this, the airport, and there are all sorts of fly equivalents now, including soccer balls and such, which are, I think, empirically tested. Okay, here's another example of a nudge. It's a virtual aging simulation done by Hal Hirschfeld, who's studied the fact that people often don't save for retirement because the future is a kind of foreign country and they're not sure that they're going to visit. The idea is if you have people aged by the magic of the computer so that they see their own future selves, they're more likely to save for retirement. And the data is pretty good, suggesting they are, because their future self is not a stranger anymore, it's them. Merrill Lynch has taken advantage of this study, and you can find exactly this that Merrill Lynch is using to encourage people to save for retirement. I've seen myself at 100. I'm not going to show you that slide. Here's another example of a nudge for diabetics. The idea is to have a traffic light system with red, green, and yellow, and that should have an impact on people just by virtue of its simplicity. And we now have data from a 2012 study by Ann Thorndike at Massachusetts General Hospital, which used two interventions. One was color labeling of the sort you just saw, and the other is choice architecture, increasing visibility and convenience for the healthy. And what we saw was that among beverages at the Mass General Hospital, the green items showed a very significant increase in purchases, about 10% in both phases, and the red ones were down about 16% in phase 1 and another 11.4% in phase 2. What I think is very noteworthy about this is there are lots of questions all over the United States about the obesity problem and healthy eating in general. Food and Drug Administration, I'll say a little bit more about this, is changing the choice architecture on nutrition facts panels on foods. The nutrition facts panel is kind of complicated, and to work with it you have to think a fair bit. This is much simpler, isn't it? More straightforward. And it suggests a clue, I think, to possible simple interventions which will make people's lives better in multiple domains. I was recently in Mexico, where there are a lot of poor people, and there are a lot of people who use ATMs. Government devised a little app where you can see on your cell phone where all the ATMs are that are near you. And if they charge you a lot to get money out, they're red. If they charge you a little to get money out, they're green. And it's having a big impact in helping people not to spend too much money at ATMs and in encouraging banks to move from red to green. Simple. Okay, here's a definition of a nudge. Any feature of the social environment that affects people's choices without imposing coercion or any kind of material incentive. So, what's going to happen in the United States, which is universal calorie labeling, I was involved in a bit on this, for chain restaurants, that's a nudge. Warnings are certainly that. Portion sizes are a nudge. Placement of goods in a cafeteria, use of colors are nudges. Default rules, on which I'll have a lot to say, are emphatically nudges. And drawing attention to social norms are nudges. So we know that people often are influenced by the choices and behavior of others, and that provides a source of a problem for many social challenges, but also a potential solution to the problems. Okay, why nudge? Here are 5 human errors that seem to me to have particular implications for government. One is present bias, meaning neglect of the long term. Remember the aging avatars. So if people think that their present self is their only real self and their future self just is someone else, then the likelihood that they'll harm that person increases. Here's a kind of neurological study that shows this. We'll do it in this room, but I'm not going to make you raise your hands or write anything down. Think for a moment, if you would, about yourself. Have a little narcissistic moment. For all of you, basically, an identifiable part of your brain just lit up, which lights up when people think about themselves. Now think about yourself a year from now on your favorite beach, if you would be so kind. You don't have to if you don't want to do this, but try. There's no machine connected to your brain right now, so no one's going to know anything about this. Think about yourself on the beach a year from now. Now, for a certain portion of you, that part of the brain that lights up when you think about yourself lit up then. But for a certain portion of you, it didn't. For some of you, when you think about yourself on a beach a year from now, the narcissistic part of the brain just didn't light up. Neurologically speaking, you are thinking about your future self if you're in that group in the same way you're thinking about another person. Now here's the kicker. For those of you for whom that part of the brain lit up when you were thinking about yourself, you will be more likely to defer gratification. You'll rather have $10 in a month than $5 now. For those of you for whom the future self is a stranger, you want that $5 now. What's nice about this is it's neurological evidence of something we have behavioral evidence for, which is that many people suffer from present bias, and that can create trouble. There's an evident connection between present bias and people's tendency to procrastinate and suffer from inertia. We know that human beings tend to be unrealistically optimistic, about 80% of people, that people have limited attention, they often don't see aspects of social circumstances, and that probability judgments are often going awry. The great Danny Kahneman, Princeton professor, has this magnificent book, which you may know, Thinking Fast and Slow, which emphasizes the difference between fast thinking, which is intuitive and automatic, and slower thinking, which is more calculative and deliberative. All of these errors noted here are associated with system one, our automatic intuitive thinking, and it can create problems. Okay, here are two things John Stuart Mill missed in this lamentably non-simple slide. One is the inevitability of nudging, and the other is human error, the previous slide. So John Stuart Mill, in his great essay on liberty, says that people are better judges than outsiders of what's in their own best interests. They have a kind of knowledge advantage. And the difficulty for his on liberty principle is that nudging in a way that interferes with liberty, it's just inescapable. So the stringent version, at least, of his liberty principle isn't feasible in this world. And what he underestimated, at least, now that we know more social science, is the potential of human error. A very recent example to bring this into policy immediately is the Food and Drug Administration in explaining its effort to create a new nutrition facts label. This is very recent, referred explicitly to psychological research. And this is very noteworthy to see psychological research being baked into government policy. And it's happened with frequency the last 6 or so years. The FDA said changes in labeling may also assist consumers by making the long-term health consequences of their choices more salient. So this is a point about overcoming present bias. Behavioral economics literature suggests that distortions internal to consumers due to myopia or present bias preferences, visceral factors, or lack of self-control can also create a potential for policy intervention to improve consumer welfare. If you read at any point Mill's on liberty, these are fighting words. It's not something Mill liked very much, referring to human error, but it has a solid scientific base. If there's any slide you remember, I hope it's this one. This is the slide of successful, simple interventions. We know now that automatic enrollment in retirement plans has a much bigger effect on savings than significant tax incentives. As a long-term University of Chicago person, I cannot believe either part of those sentences. I have to explain that a little bit. At the University of Chicago, we know, and we have a Nobel Prize winner to prove it, that automatic enrollment shouldn't have a big effect on whether people save, so long as they can easily click out if they don't like it. If they can click in if they want it, or click out if they don't want it, whether you're automatically enrolled or not, it shouldn't matter. Coase theorem says that, but it really matters. If people are automatically enrolled in a retirement plan, that tends to be sticky. And this we're finding in multiple domains. A little homely example is the screens you're seeing on in taxi cabs now, where you can put your card through the slide with the default tips, which are often 20, 25, 30%, a little higher than the pre-screen tips. That's produced a 10% increase in tip intake among taxi drivers in New York. That's a $600 raise if you're making $6,000 a year on tip. And it's just because of the default. It's easier to take the default. Okay. The United States government has responded to this social science and is spurring automatic enrollment. In fact, automatic enrollment is taking the workplace by storm now because employers know it's a simple, cheap way of getting people to be a little more comfortable, maybe a lot more in In 2009, Congress enacted a law called the CARD Act. It's about credit cards. That law has a bunch of nudges in it in the form of default rules and disclosure requirements. It is saving American consumers over $20 billion annually. I confess I was there when this was enacted, and I did not anticipate numbers of that sort. The best news of all, in a way, is that a disproportionate amount of those savings are going to people with bad credit ratings. The reason that's really good news is people with bad credit ratings are the people who need some economic help, and the disclosures and default rules are providing that help. There's a company called O-Power, which mails, maybe you've seen it, a home energy report, where you get information about how your energy use compares to that of your neighbors. The home energy report is having an effect on energy use comparable to an 8 to 20% increase in the short-term price of electricity. To increase the price of electricity, either through economic policy making on the private side or through government action, that's really complicated, given the fact that there's a lot of regulation there, and Congress and state legislators don't exactly like the idea of increased energy taxes. It's really complicated. A simple short note has the equivalent impact. There's a federal financial aid form, some of you are probably familiar with this, that is very detailed. It has had well over 100 questions. A recent study shows that if you simplify the form and give people a little help, it has the same effect in increasing college attendance as a several $1,000 increase in the economic subsidy. The idea here is that the government may have a choice: increase the subsidy, which maybe the Council of Economic Advisors would favor, maybe not, or simplify the form. Simplification of the form is simpler and cheaper. For many areas, this is a challenge and an opportunity in an economically troubled time. Okay, here's some examples of the power of default rules, which I think are the most promising nudges of all. Together with others, I ran a little conference at the White House on open government and transparency a few years ago. And the forms for the participants said, you are going to get bean sprout and soy cheese sandwiches when you come. If you don't want that, but want some other kind of sandwich, please opt out. And there's nothing obscure or hidden about the letter. The people came, hundreds mostly of government employees who were smart, and they were told you're getting the bean sprout and soy cheese sandwich. 80%. They, of course, were alarmed. Very few people like that kind of sandwich. But even among a very educated group, attentive to forms and letters, 80% of them stuck with the default. Okay, they were given, by the way, the sandwiches they wanted. They weren't forced to eat the bean sprout and soy cheese sandwich. I mentioned with savings the power of defaults. We now know that if an institution changes from a printing default of one side to two side, it can save 10% in paper costs. 10%. Even if people can costlessly go to one-sided printing, if that's what they want to do. By contrast, an effort at education and moral suasion, asking people to save paper and therefore money in the environment, has had zero effect. And a 10% increase in the cost of paper, which users have to face, produces a 2% decrease in paper use. The simple approach has a larger effect. In Germany, there's been a great deal of interest in encouraging more use of green energy. Consumers typically say that's what they want, but up until very recently, 5% or less of German energy users choose green energy, even though it's available. There are two communities in Germany that use a lot of green energy. Over 95% of those communities are green energy users. You might wonder, and it's a reasonable wonder, whether there's some complicated policy initiative to get people to choose green energy in those communities, or whether they're just antecedently pro-green, Maybe they're environmentally attuned in those communities. Those are reasonable speculations, but they're not right. The only thing that makes these two communities different is that they have a green default. Consumers are told you have green energy. If you want to pay a little less, you can switch. Or if you want to pay a little more in one of the two, you can switch to greener still. And they just don't. The green energy default sticks. Imagination is welcome to think about other domains in which a simple switch in the default would have large effects on health, economic values, or on environmental values. Okay, you may remember the old food plate, the old food pyramid from the United States Department of Agriculture. I'm told that it was the most visited website in the entire US government's repertoire. There's a person, gender unclear, walking to the top of a pyramid with a little circle at the top. Maybe it's a triangle. It's white. Is that thinness, that white spot? Is it death? Is that where that person's walking? The foods are kind of crunched together in the bottom. The only one I recognize, maybe you can see what the others are, is the one on the bottom right, which is clearly a shoe. Does that mean one's supposed to eat a shoe? Okay, this is very complicated and devised by honorable people trying to inform students and teachers and parents and others about healthy eating. We replaced the food pyramid with the food plate, which you may have seen. It's really simple. It says essentially make half your plate fruits and vegetables. I had a friend in the government who was involved in an international negotiation a few years ago. Pretty important international negotiation. The president was going to that country, and it was important that there be something tangible that emerged from this use of his time and his commitment. And a few days before the negotiation, everyone in the US government thought it was doomed. There was just intractable non-agreement between the US and the other country. It wasn't, by the way, Russia. It's a lower visibility country than that. But still, it was important to get some kind of agreement. And everybody was blocked. A friend of mine was involved in it, and I called the person, or the person called me, from that country the day after the negotiation. And I asked, how did it go? And the response was, great, which was a big surprise. And I said, how, why? And exploding over the international line were the words, plate, not pyramid, which I didn't understand so well, but I will now explain. It's that when things were blocked, both sides looked like this. There was complete ambiguity in what was sought. Once the negotiator, the US negotiator as it happened, turned it into plate and said, here are the 8 concrete things we want. Then the other side said, oh, we agree with 4 of them, and with the 2 of the other 4 were pretty close. Which suggests the following large lesson, that sometimes intractable disagreement or resistance is really a response to ambiguity. And once things are simplified and clarified, then people can come into alignment when they didn't before. Okay, here's the little mini constitution for the regulatory state. Everything here belongs in bold letters, especially the words cost-benefit analysis and maximize net benefits, the first slide. But the one that's getting the bold is the part that says each agency shall identify approaches that reduce burdens and maintain flexibility and freedom of choice for the public. These approaches include warnings, as we've discussed, appropriate default rules, and disclosure, as well as provision information in a form that's clear and intelligible. You can think of this as the simpler provision in the executive order, directing all agencies to err on the side of freedom of choice. Okay, we know that simplification can be a helpful nudge and complexity has really bad effects. And things that were done in recent years, maybe you've observed them, are efforts to simplify requirements and make forms shorter and easier to navigate. One example, which is something that millions of people are now benefiting from, is the United States Global Entry Program, which says that when you're coming back into the United States from abroad, you're not going to have to stand in those lines anymore. you'll just put your passport in a kiosk and slide it through, and it takes approximately 15 seconds to get through the line. And the Global Entry Program, which is for international travelers, has helped make common the TSA's program for TSA Pre, where you can go through the simpler, shorter line, not take your shoes off. Okay, that's just an example of convenience. Another thing very much in this vein is that the Department of Transportation recently simplified the requirements it put on Americans when they're traveling, so that you can keep your cell phone on so long as it doesn't have a cellular connection. You can keep your computers on, you can keep your Kindle on, etc. Is this familiar if you're traveling? And while these are not, huge economic or health savings, I'm going to get to some examples that are. Okay, I've noted that social norms are nudges, and we have one of the world's leading experts in the room who works on social norms, so I'm going to have to be cautious about this. But we do know that with respect to seatbelt usage, for example, there has been a massive change in the United States, pretty much in a hurry, produced by an interaction between social norms and legal requirements. What makes the seatbelt phenomenon really interesting is that there is compliance often with little or no enforcement. The existence of the law might be a signal of what the social norm is, or it might be authorizing people in the car to buckle their belts or to ask people to buckle their belts when they weren't otherwise. I think what makes the seatbelt case interesting is that it shows that our actions actually have meanings associated with them. And those meanings may be ones we don't, on reflection, adore, and that operate as either subsidies or as taxes. That's a little compressed, but let me spell it out a little bit. If you live in a nation where buckling your seatbelt has a meaning that is, you're a scary driver, or I'm a cowardly person, then you're not likely to buckle your seatbelts. If you live in a college community where speaking in racist terms or bullying people is subsidized in the sense that it's a cue to popularity, then you may kind of hate those things, but you do them anyway. You might not buckle your seatbelts if it's a tax, if you're taxed because you look like a coward or an accuser. What's happened with respect to seatbelt buckling, and in many places smoking, is that what was once a tax is now a subsidy, and what was once a subsidy is now a tax. So that to ask someone not to smoke who's smoking in a public place is completely fine now. There was a time when its meaning was, you're a horrible, intervening, freedom-despising person. To ask someone in your car, do you want to buckle your seatbelt, is completely fine. It's slightly aggressive, but it doesn't have anything like that social tax it used to have. Okay, the two areas now where there's a lot of importance in using this is obesity and distracted driving, where the social norms aren't ideally where they should be. And the First Lady's Let's Move campaign is attuned not to aggressive government regulation, but more simpler strategies that involve information and norm transmission that would get people to, especially kids, to focus on their weight. With respect to driving, a nice fact, in 2011, deaths on the highways were at their lowest level in recorded history. That's a stunning success story. And it's been made possible in part by norm changes involving drunken driving, seatbelt use, etc., as well as by cost-justified regulatory initiatives. And a big question for the next 10 years is, what can we do about distracted driving? Okay, this is a website, Regulationsgov, and the biggest surprise I had in government, and in retrospect, it remains a surprise, is that government regulations are meaningfully affected every day by a process of public comment that sophisticated administrative law professors believe to be a charade. So the sophisticated view, which is still in my administrative law casebook, is that when agencies give the rules to the public, it's kabuki theater. The real action is in the internal meetings, the meetings with the interest groups, and the public comments don't matter. Not true. The public comments are a form of choice architecture for choice architects, and the attentiveness that government officials pay to the comments that come on Regulationsgov is remarkable, and it's a function of the government's awareness of its own lack of information. It's not fundamentally about the government's concern for legitimacy in the political sense, though that's part of it. It's much more that the government officials know we may not know things. And if someone from Princeton says, you made a big mistake on the science, or you got the economics wrong, or this is going to have unintended bad consequences, or if you get something from a small business group in California that says this is going to crush us at an economically hard time, and if you change it in this way, it won't, has a big impact. Okay, simpler. I mentioned the regulatory lookback, which is part of Executive Order 13563. That's a memorable name, isn't it? Executive Order 13563. It almost rhymes. Not really. Okay, it requires agencies to come up with plans for simplifying their rules. Over 24 agencies have released reform plans, over 580 initiatives. A small fraction are saving billions of dollars over a 5-year period. Here's one little one that is exemplary. You may notice that the nozzles at the gas stations have air pollution technology on them, or at least stuff on them. Some of that stuff is air pollution technology. And some of that, in some states, has air pollution technology that's completely pointless because the cars already have the technology built into them. It's pure cost. And it took some energy on the part of the Environmental Protection Agency to eliminate that requirement, saving over $100 million each year. Better than that is the Department of Health and Human Services removing unnecessary requirements imposed on hospitals, nurses, and doctors, saving over $1 billion annually. And that is part of a parcel of reforms, simplification reforms, which, and to me this is the one that's most meaningful, reduce restrictions on telemedicine in rural hospitals, where there are patients who need help, couldn't get help because use of the internet or the telephone was not allowed. A regulatory restriction that had a good faith motivation but no longer is justified, that was eliminated, saving tens of millions of dollars in costs annually, but that figure doesn't capture the full benefit of the rule. Over 100 million hours of paperwork burdens are on their way out. Okay, almost done. Future directions. What I described for the financial aid form is exemplary of what we should be seeing in the future. If you look at modern technologies like a tablet, it's completely navigable by a 3-year-old or a 4-year-old, even though the technology that went into it is so complicated 15 years ago it couldn't have been fathomed. That should be a model for government, where navigability, simple navigability, is the rule of the day, even if the thought that went into it is really complicated. We need to ramp up empirical assessments of the human consequences of what's done, and here universities are absolutely central. We need more retrospective analysis of rules. There has to be more attention to cumulative burdens for government to keep in mind as it's imposing requirements. And we need much more in the way of good faith nudging by the private sector, which can both do good and do well. A little tale for you is, up until recently, a lot of people were finding that their cell phone bills were uncomfortably high because they'd gone after their minutes and they didn't know. The FCC proposed a rule that would require notification. That's a complicated process. It got the attention of the industry, which said, we have a simpler idea. we're just going to send people messages. And that is saving people significant amounts of money by giving them advance notice. Okay, so we're at the tip of a large iceberg. Thanks.
All right, we have about 20 minutes or so for questions. Students.
Hi, my name is Jacob. I'm a junior in the mechanical engineering department. Something that I experience a lot is whenever I travel is the complicated procedures that I have to go through when I'm traveling in airports. What would be something that you think would be a recommendation for how to simplify that process? Because there's a lot of empirical evidence that doesn't really make us safer, even if it makes people feel safer. What are your thoughts on that?
Okay, so the security apparatus. The only thing I'm clear on, I'm clear on two things. One is to do some careful cost-benefit assessment of security requirements is a good idea. It's daunting because if you're talking about terrorism risks, it's a 1/n chance of something horrific, and we don't know what n is, and that makes the cost-benefit calculus that you can do elsewhere harder. But sometimes it's clear that the n is really, really tiny. So the fact that people can use Kindles and iPads on takeoff and landing, that's because we know the n is so large, the 1/n, don't worry about it. The risk is tiny. Some of the problems that international travelers have do involve passport and customs control. And as I mentioned, the US has moved away from a one-size-fits-all approach. So it knows that a lot of people just don't present the kind of risk that requires the standard security procedure. You can have an expedited one. And that's really good. So that provides a model, I think, for the future. Probably good to know whether the technologies that are slowing people down are contributing materially to risk reduction. And it wouldn't be amazing to find that some countries are doing some things that just aren't.
Thank you for your remarks, Professor Sunstein. First, I should say I speak on behalf of a lot of the master's students here. I'm a master's student myself. When I say we find the idea of libertarian paternalism, I think empowering and appealing for the obvious reasons you outlined. But I wanted to probe the idea. You brought up John Stuart Mill. I think a lot of us can look at something like a universal calorie labeling law as, I guess, a nudge. This is a change in choice architecture, unobjectionable. On the other hand, we see other examples of bigger nudges, maybe. For example, New York Mayor Michael Bloomberg's proposed, ban or restriction on large soft drinks. And I'm wondering, I guess, at one point in your book, you define nudges as changes that make bad choices more difficult and good choices easier. But at what point do you draw the line between a nudge and something that might run afoul of John Stuart Mill's conception of liberty?
Okay, great. Thank you for that. So maybe start by giving a simple answer, and then it'll get a little more complicated with your indulgence. So the simple answer is that Mayor Bloomberg's proposal, for better or worse, just wasn't a nudge. So if you say you can't sell large drinks in big gulps, as they are called, that's not a nudge. It's not like a disclosure policy or a default rule. It's not drawing attention to social norms. It's a form of coercion. So what he was doing would not be libertarian paternalism. So the idea behind libertarian paternalism, which we didn't call our book, we wanted to at one point, maybe no one would have bought it. The idea is you preserve freedom of choice, meaning you impose no coercion or even costs on people who want to go in another direction. So what's meant by costs is really material costs. So, and now it's starting to get a little more complicated. So if a subsidy is not a nudge. So if you say, if you bring your own bag to the CVS and don't ask for ours, you'll get a nickel back or a dime back. That's not a nudge. It's cheap incentive, but it's not a nudge. If you say, as DC did, you have to pay a nickel for a bag. That's not a nudge. It's very effective, but it's not a nudge. So the nudge category, I think if you're a libertarian fan, is pleasingly narrow. So a GPS imposes no costs on you if you think I want to take the long route, and a calorie labeling imposes no costs on you if you say I want the brownies. And a default rule, if it's working in the nudge system, imposes no material cost on you if you just press the button and say I don't want that retirement plan. So the narrowest conception of the nudge is that it's soft paternalism imposing no costs on people who want to go their own way, and it's means-oriented rather than ends-oriented. That is, it's trying to help people to find the right means to find their own goals, to achieve their own goals. It's not displacing their own goals. So you could think of the most nervous-making forms of paternalism maybe as being those that are hard, coercive, and also those that are ends-focused. You shouldn't be, worshiping the wrong God or falling in love with the wrong people. That would be ends-oriented. So it's both means-oriented and soft is what is being sought. I think to get a little more complicated than this, the nudge idea, which is a very simple set of tools, are meant to add to the regulatory repertoire things. And my hope is that those who, like Thaler and me, are very enthusiastic about freedom of choice would think there should be a presumption in favor of the choice-preserving options. But I wouldn't want to say that the presumption's irrebuttable. So if there's a ban on suicide, on certain factual assumptions, that's a good ban, because you might have present bias people who are suffering from short-term distress, who are throwing their lives away, and to have a norm or a law that, has some effect in holding them back, that's really important. Another example, which I think is not as intuitive as the suicide one, and this is the last thing I'll say on this, you're asking a great question, is the fuel economy example which I gave. Remember I mentioned that the fuel economy and energy efficiency rules are saving consumers billions of dollars? It's true. It's not a nudge. These things are coercive. And what makes them kind of complicated to justify is that they're coercion that can't be sufficiently justified by pointing in mill terms to harm to others. So the energy efficiency and air pollution and fuel economy rules, they do have air pollution and energy security benefits. They make us more energy secure and they make the air cleaner. But those benefits aren't high enough to justify the cost of those rules. That's just a fact. What makes the benefits justify the cost is consumer savings. That's kind of complicated because consumers, if they want, can go buy the Prius or they can get the energy efficient refrigerator. They can even be nudged with information to do that. And so the Department of Transportation and the Environmental Protection Agency gave a behavioral account saying that there's some form of myopia or a problem of salience when people are buying cars, which is a form of market failure, not a standard market failure. It's a behavioral market failure. If you're with me, it's not a harm to third parties, it's not a collective action problem. It's just people are buying cars that it's not in their economic interest to buy because they'd be net winners if they got the more fuel efficient car. Now, the reason this is mentioned is that on Mill's account, that's terrible. Let people choose their own cars. How does the government know? Now, some people think Mill is right in this case. If Mill is wrong, it's that the government just knows. It's not like fancy valuation questions about what people's tastes are. It's if you get a more fuel-efficient car, you're going to save money. Not on the day you buy the car, but over the life of the vehicle. And pleasingly, for those who, like you, I guess, and me too, freedom of choice is something not to be interfered with lightly. The fuel economy rule has a lot of choice in it. It's fleet-wide average. It's not everyone has to get a Prius. But that's one where the It's not libertarian paternalism. It's a form of paternalism, full stop. And I would have a pretty strong presumption against that. But if the cost-benefit analysis comes out a certain way, presumption might be overcome.
Thank you.
Thanks for being here, Professor. I'm wondering if you might talk about how your work fits into the age of sequester and sort of lessened interest in ambitious government projects. Because it occurs to me that your work might, on sort of cost-benefit analysis in government and changing individual choices might have a lot of appeal when you don't have a lot of money. Another possibility is that it licenses policymakers not to get involved in ambitious public projects just because if we can nudge people to put more money into their 401ks, we don't need to make Social Security more generous, for example. So how do you see your work fitting into the current political situation?
Great. So I tend to think that the word ambitious for government programs is neither a word of praise nor a word of blame. So if ambition as such has no valence associated with it, if what we mean by ambitious is expensive, either for the private or public sector, it's not unreasonable to think that put the sequester to one side in a time when people's budgets individuals' budgets are tight, and the government's budget is tight, to try not to have very costly impositions and programs isn't the worst idea, unless you have confidence that all things considered, there's going to be a welfare gain. So the idea of having programs that are automatically going to enroll people in retirement plans or health care plans, by the way, which is in the Affordable Care Act starting in 2015, it's not expensive by itself, and it's effective. I'll tell you one that's kind of complicated. Your question suggests that what I'm giving by way of answer isn't adequate, really. One of the most effective nudges, and it's very quiet, it has bipartisan support, is that in recent years, is that kids are entitled to school lunches and school breakfast for free, if they're poor. That's the law. But a lot of the kids who are poor aren't getting those lunches because they have to sign up for them. And the poor kids and the poor families that's not simple. So there's a program which Congress has authorized called the Direct Certification Program, which allows school districts directly to certify kids for the programs on the ground that they're completely eligible and they shouldn't have to sign up the forms. Now, in terms of the numbers of children who are eating in the United States now, this is a very ambitious nudge. We're, I think, well north of 1 million kids are eating who wouldn't otherwise be eating because of this. And that does have cost and has a budgetary consequence. But it's a budgetary consequence that is consistent with what the law is saying, which is poor kids get to eat. And to say that the form-filling challenge is a filter on who gets to eat, that's very hard to defend. So this is a kind of long-winded way of saying, I think to be cautious about ambitious in the sense of costly programs isn't the worst thing if you're hitting the private sector with new stuff, or if you're hitting the taxpayers with new stuff. But to have things that give people nutrition or do something to put more money in their pockets, that's great. So the health one I mentioned, the healthcare one, where $5 billion of savings is produced, that's really ambitious in the sense that it's big savings, but it's kind of goes the other way. It's putting money in people's hands.
Hi, my name is Ariel. I'm a junior here. My question kind of feeds off of the program that you just described and also the earlier question about TSA. While I understand how Mill and Nudge can certainly mechanically change people's incentives and what they desire to do, I was wondering from your perspective, what are the end goals that should be motivating the use of these tools? Because if you think about something like the TSA, on the one hand, we have pre-screen, which is purely an efficiency mechanism. On the other hand, you have kind of global entry, where people have to pay for expedited entry into the United States, but at the same time, you can make the exact same kind of efficiency, resource-based argument that you want people to be able to enter the United States quickly so you don't have to have as many people. And then when you talk about the lunch program, you're not just kind of making it simpler on a technical level, and that's the goal. You're also advancing a certain kind of fundamental policy view and worldview that some people within the United States government might not agree with. So where do you draw that line between, I guess the question is, where do you draw that line between kind of technical change and what motivates that? And can this be applied to, bigger issues of equality and poverty and so on?
Okay, great. There's a lot there, so let me just say a little bit. There's the question of the social planner, and then there's the question of the executive branch actor. So if the executive branch actor is thinking, there's a policy which is to make sure the kids eat and also encourages the elimination of form-based barriers to the kids eating, then the executive actor might say, I'm just going to implement those policies as effectively as I can. And I'm not a social planner. And I think that's fine. But I think your question really goes to the social planner issue. And as a first cut, social welfare is our goal. And if it's the case that, from the standpoint of social welfare, poor children having those meals gain more than the people who are paying for them lose, then we're pretty well in business. And even if the welfare calculus is a little less than self-evident, the fact that there may be a distributional component, a justice component that would play a role. So to think in terms of social welfare is probably the best framework. On the global entry program, the security loss to the United States is essentially zero, and the convenience gain to travelers is really high. So it seems like a big winner. When the Department of Transportation eliminated some of the restrictions on electric uses in planes, thought this is a convenience for people like it, so there's a welfare gain, and there's no safety justification for stopping them. When the restrictions were eliminated on telemedicine, there was originally a patient safety rationale, or something in that universe at least. It doesn't really have any force. So the allowing telemedicine has hardly any cost, maybe none, and all benefits. So maybe the message is the cost-benefit analysis is something that seems kind of technical and inhuman, but one way to think of it is as the best method we have for getting hold of the human consequences of the things that private and public institutions do. And that if you don't have that, you're going to be at the mercy of interest groups or anecdotes or professional expertise. And of those, probably the third is the least bad. But if it doesn't have an evidence base, it's pretty bad. So in all of these ones, I want to think, as disciplined as we could be about costs and benefits. That was, in my job in government, that was like a lodestar. The president directed that. And I can't emphasize enough how helpful that was. Because whenever you got confused, at multiple voices saying things, you'd think, well, is this program going to cost people money, where money could mean like a life, that's money, that's monetized, that's a cost, or are they going to get sick or not, and what are you going to get from it? So I'll tell you a little government story. I'll tell you a great story. There was one rule I was involved in. Alan was not in this conversation, where I was talking to people about it. It was coming out in a week. And someone in the government said, not someone you would have heard of, certainly not the president, but someone in the government said, well, who's going to like this rule? What group is going to applaud it? And I tend to know nothing about this, but I happen to know the answer to that one, which is none. No group would applaud it. It was just too subtle. It wouldn't get any attention. And then, so I said none. And the person said, then why are we doing it? And it's a great person who asked me that, but it's a terrible question. We were doing it because it had significant benefits for people. It was going to make their lives better.
Thank you.
We have 2 students left, so maybe we can squeeze 2 questions in. Please, here.
Thanks for being here this afternoon. My name is Lauren, and I am a freshman grad student here at the Woodrow Wilson School. You mentioned the new menu labeling requirement in the ACA, as well as use of evidence in our policymaking, pushing for more evidence-based policymaking. From my reading of the recent research of menu labeling, there is, at best, little benefit from menu labeling. At worst, potentially negative outcomes from the menu labeling. And given the cost to restaurants, I'm just wondering if you could respond to that and also kind of give some advice to future policymakers about how do we balance the desire to innovate and bring these behavioral principles into policymaking, but not also wanting to get ahead of the evidence. And how can we work with that?
Okay, so on menu labeling, the rule hasn't been finalized. There's a proposal from a while ago. There are a bunch of comments on it, and while the statute requires it to be done, there also has to be a cost-benefit analysis that answers your question, what are the effects going to be? And if that analysis is too upbeat, then it's incumbent on the government to listen carefully to the more skeptical views. I read the evidence, by the way, you probably know it better than I do, but I read it as more equivocal. There's a study of Starbucks in New York, you probably know of it, Bollinger, NBER, that shows a significant impact. There are some studies that go the other way, but it's an interesting puzzle, the fact that the studies aren't uniform. There's a recent collection of all of them, you probably know it, that has about 40 of them in graph form. And I don't think it would be, my reading at least isn't, that this has no effect or a negative effect. It's just it's very unclear. And then the question is, what should the cost-benefit analysis look like given that? One possibility, by the way, which is observed in some other areas of disclosure nudges, is that while consumers aren't paying a whole lot of attention, producers are. They change their behavior accordingly. That's actually behaviorally really interesting. Why would it be that profit-minded producers would apparently irrationally respond to what they're anticipated but wrong consumer reaction? But that one question is whether the best account of the calorie labeling thing is that producers are going to change their offerings, even if, okay, so that's, but you're right, all of this has to go into the evidence. It's a great question about letting policy initiatives run ahead of evidence. And in general, one ought not to do that, but there would be kind of probability distributions with the benefits and cost side. And the fact that you don't have decisive evidence that something is good wouldn't be a reason not to do it if the probability is, and the cost isn't very high. So ideally, that you'd want to do something like that. You might not have enough evidence even to do that. There's a very cool thing, this is probably going to get a little technical, but it's called break-even analysis, where the government says, look, we don't know what the benefit is of this, we know what the cost, what would the benefit have to be for the benefits to justify the costs, and then you start analyzing what they'd have to be, and you might have data enough to make a plausible judgment that is probably dumb or probably a good idea. And in cases that seem intractable, I'll give you a recent one. They didn't quite use break-even analysis, but it's only one step away. Well, I'll give you one where they did use break-even analysis. Disability access, where people who use wheelchairs can't get into buildings. New buildings are going to have to give them access. For bathrooms, one component of the rule, the costs were just higher than the benefits. It's not good. My old office, we don't like that very much. How can this be justified? The Department of Justice said, well, this is the monetizable benefits, but these are disabled people who want to be able to use the bathroom without getting their colleagues involved. How do you monetize that? They don't really know, but but if you monetize humiliation at even a really low amount, it's worth it. And so maybe in some of the cases you're describing, that can provide a foundation for action when you don't have the knowledge base yet.
Let's take a final question, a little bit past time.
Hi, Professor. Thank you for being here. My name is Jakar. I'm also a master's student. I wanted to ask, to follow up about your point that social norms can also be nudges. So I'd like to know, what are possible things the government can do to change social norms? You talked about Michelle Obama, but she's a very popular figure. She really uses the media very well. Sometimes it's hard for the government to put out cool campaigns. So are the solutions just, kind of campaigns, informational campaigns, or are there other possibilities that the government can do to change social norms?
Here's something that was done in the UK. This was more a use of social norms than changing social norms. But in the UK, there's a problem, as in all countries, of tax delinquency. And so they sent letters to people saying, you're in a minority of people who aren't paying your taxes on time. And instead of saying, we're going to punish you or we're going to help you file, they just said, most people in your community pay, you're in a minority. Then they got a significant increase in the likelihood that people would pay. Now, in terms of changing norms, I think the best psychological evidence we have, and it continues to come in, maybe is captured under the rubric of the surprising validator. So if you have someone who is known as a something, let's say known as a very pro-business person who doesn't really like Democrats very much, who says that sexual harassment is completely unacceptable and it's inconsistent with what American business values, or that same-sex marriage is part of what America stands for. That wouldn't be, neither of those would be amazing validators, but they'd be mildly surprising. And if you can find, if you can find someone like the Army the military's had a big impact insofar as it's argued in favor of affirmative action policies in communities that are otherwise ambivalent about affirmative action policies. So if there's an emerging norm for the government to endorse it, could possibly be self-defeating under certain assumptions, or not so helpful. But if they can enlist people who are credible, that can work. Especially if it's not thought that the people who are being enlisted are basically bowing to the government, but instead think it independently.